Welcome, my name is David Lusale, Dr. David Lusale. I work for Lev Mwanawasa Medical University. I train the clinical practitioners for the last 18 years. In this webinar, I'll talk about Afro primary health care. And there are three questions that I would like to address. Who are we, as question number one? And how relevant are we to the Afro primary health care? Number two, I'll talk about what are the expectations of the community about the primary health care services delivery in Africa. And not the least, number three, I'll talk about what I think should be the composition of the primary health care team in Africa. So coming to the area one, I have a background of being a clinical practitioner. I worked as a clinical officer and later a medical licentiate. And of course now I'm a lecturer with a doctorate. I'm the immediate past president for the African Network of Clinical Practitioners. I have a lot of experience in terms of work at primary care level, so within primary health care setting. So clinical practitioners in Africa are part of the healthcare system, and they are part of the multidisciplinary health professions that you find in any health system of Africa, at least in not less than 50 countries now. And globally, in Europe, as well as in America, even Austria, Asia, they do exist. And these are trained in health, in educational institutions at various levels. Some train for 2 up to 4 years. They do obtain their certificates, diplomas, and degrees, even specialize. Now, what is their relevance? Having mentioned they form part of the core team, and most of them, their job function in Africa is that they are the frontline healthcare providers. They do exist at community level and in most of the first level health facilities and clinics. So they are close to the community. They form a link as the first contact doctor or clinician between the community and them, and also between the health facility and the second level or tertiary level of care. So they are very, very vital. And in provision of their care, it's not just curative. They do advance the preventive, they do advance the promotive, they do advance the rehabilitative and palliative care. So the community hold them in high esteem as clinicians who offer them the immediate help that they need to continue with their social and economic aspirations in as far as their health is concerned and development of their lives. And I've seen it all here in Zambia. Having said that, they are of different nomenclatures in most of these African countries. In Eastern Central Africa, we do have among them clinical officers, the medical assistants, and those who go further in their study, they reach ranks such as assistant medical officers, medical licentiates, emergency health officers in Ethiopia. And we do have associate clinicians like in South Africa, surgical technicians in Mozambique, in West Africa. We also do have the physician associates and the physician assistants like Liberia. So these are the different nomenclatures that exist, but all in all, they are primary healthcare practitioners. And most of them do practice at first level care as well as at community level. Number two, I quickly want to talk about the expectations of our communities. There are many expectations that they expect from the primary healthcare delivery system. One of them is that the healthcare system will not only bring projects to them, will not only suggest programs that should exist in their communities. One expectation is that they want to be participants. They want to collaborate. In other words, they want to take part in the planning, in the implementation, in the evaluation, even in the re-implementation of these programs. They have learned a lot about health. They have learned a lot about what makes good for them. Sometimes what they need are not more health posts. However, that doesn't mean they don't need them. But sometimes their immediate cry is that they need clean water. So they need more wells than the health post, because that's the need they have had for so many decades. Sometimes they will say they need a good road in place of a health post. These are important things. So sometimes they think they've been left behind. They only receive these programs or projects as dictated by the political system. They have aspirations for their children to go to school, so at times they want schools that are near them. The same, they would like to have some maternity units that are near them because the reproductive health services are not well distributed closer to them, and they are still experiencing challenges and experience all these high maternal mortality rates, maternal mortality ratios. So are the childhood illnesses and high childhood mortality ratios as well. So it is my hope that in the Afro primary health care, as we talk about the aspirations of our communities, our approach would be, we are not designing programs on their behalf, but that we shall be able to sit together, incorporate their leadership into the planning, incorporate them in the dissemination, incorporate them by recruiting some of them to be part of the implementers. So even as we think of training, sometimes it's appropriate to have quotas, specifically not only looking at qualifications at their high school level, but looking at their ability of what they are able to do for retention purposes in the human resources, and people understand the culture and the social background of their populations to go back there. Thirdly, I'd like to conclude by talking to you about who should be part of this primary health care team here in Africa. By and large, most of the time it has been thought this should be left to the nurses, this should be left to the doctors, this should be left to the clinical officers. My view is that all healthcare providers or professionals can be part of the primary healthcare. In diversity, we shall be able to contribute to many needs of our communities. So in this particular principle or philosophy, I believe that there are some who have sat back as health professionals thinking they may not play an important role. About 2 decades ago, probably surgeons never thought one day they could be advocating for primary health care surgery. Today we have seen automobile accidents have increased, and disadvantaged areas, peri-urban or rural areas, have not been spared. All these call for sensitization and education in that line, that we all take responsibility in order to reduce the morbidity and mortality that is caused every year through accidents. Nutritionists probably were only left to be demonstrating the nutritional values at health facilities, but they are very important to go out there in the community. So in concluding, may I simply say, as Afro primary health care, there is need for us to put our efforts together and begin to see multidisciplinary professions playing their vital role even at primary health care level. So it is my belief that at the end of the day, as we begin to advance this platform, we shall be able to reach to every healthcare profession and stimulate them to think about primary healthcare services. What is it that they can contribute? So others are just spearheading, but I think there is room to pull everyone together for the good of our communities. Thank you for participating, and it is my hope we can discuss further.